Thank you very much. And this has been indeed a pleasure to speak to your group about this most important subject. So I'll go right into it. We'll share our screen and let's see. Okay, I think we got our screen shared now. Okay. Are you guys seeing our screens pretty well? Just want to make sure.
Yes.
Okay. So a bit about myself first. I was born in the little island in the Caribbean. Some of you may have heard of it, called Grenada. It's a little bit north of Trinidad and Tobago and Venezuela. And I moved to the United States when I was 16, did college in Michigan, Andrews University, and then I went on to University of Medicine and Bioscience, and I studied osteopathic medicine, where I got my DO degree, and then I went to Detroit in Michigan and did an internship at Botsford Hospital in Farmington Hills, Michigan, followed by my residency in neurology at the University of Miami. So I studied, that's a 4-year program, and following that, I did a postdoctoral fellowship in neurological trauma and neurological rehabilitation. Thereafter, I became the medical director of the neuro rehab program and the brain injury program at the University of Miami. I held this position until 2015, actually. And then during this time, I also became head of the sports medicine concussion program at the University of Miami, treating athletes. So, it's been a ride over the years, participating in these ventures. And also, so my role as both involves leadership and administration, and also the practice and delivery of healthcare services. I've developed an interest in the policy side of healthcare, trying to deal with systems, how they work, how we can improve the quality, the costing, the services. And that interest came as a result of working in the area of catastrophic care, because as you all know, healthcare is a very costly venture. And that's one of the leading causes of bankruptcy in the United States and the world, is that someone having a health challenge, that the cost goes beyond their resources or beyond what they are insured for. So clearly it's an important subject to deal with. I've been involved, I've operated and developed several companies, one of them being the practice that we have right now. We have a practice with 6 neurologists that we work as a team. We have a center called the Design Neuroscience Center. I also run a company that's a network of doctors and hospitals called JIPA Network. We're primarily involved in helping people in foreign nations find access to catastrophic care. We also work with nations to help them build healthcare delivery systems to cater to and care for people in their countries. One of the challenges many of these nations have is that they don't have the healthcare delivery systems that we have in the United States or in other developed nations, and also they don't have the financing models to be able to provide really good healthcare for people. For me, it's not just about practicing medicine, but also bringing to the cause important directions that would help us deliver better services in healthcare. My big focus, though, is in traumatic brain injury and concussion. That's where I've gotten most of my education, my training, and it's been an incredible ride. I currently work in the Kendall Regional Hospital System. We run the trauma program, and we're about to take over most of the neuroscience program there. But I still have some affiliation with the University of Miami and the Jackson Health System, where I did most training and worked for many years. So I'll start by talking, answering the question, what is neurology? Neurology is the medical side of neuroscience. There's the surgical side, which we refer to as neurosurgery. There are certain diagnostic sides, one area called neuroradiology. There's another, and there are subspecialties within neurology. So for example, the neurology of the visual system is done by a group called neuro-ophthalmology. The neurology of how the brain works in terms of the brain waves, we call that electrophysiology. And within that subspecialty, you have electroencephalogram or EEGs, where we look at brain waves, and then you have nerves, peripheral nerves, where we look at muscles and nerves, what's called electromyogram, and nerve conduction studies. So we have another area of specialty, cerebrovascular disease, where we look at stroke. These are all specialists subspecialty training that you go on to after you finish neurology. So the area I'm involved in is neurological rehab and neurological trauma. And my interest has been traumatic brain injury and concussion. So it's basically the brain is the most, what we say, the most sophisticated. Well, first of all, brain injury is the most sophisticated disease, or the most complex disease of the most complex system. And when you think for a minute that we have over 100 billion nerve cells with well over 1,000 trillion connections in one brain. This is a marvelous system in how it's designed. When you think of having millions and millions of nets, let's take fishing nets, and you pile them up and they all link each little segment to each other, the brain uses this nodal system where there are connections between nerve cells to cause electrical currents that produce organized human behavior. It's just a fascinating system. And to think that this system could be injured in a moment. It takes from birth to when we die, we have a kind of a bell curve where we develop, we reach to a peak, and then we start declining. By the time you age 90 to 100, you only have about 10% of all the brain cells that you were born with. So as humans, we go through a process of developing, and then we go through a process where we become back to where we were in the beginning. So it's fascinating to me to understand how, as humans, we organize our brain in the most sophisticated way. We go to school, we learn, we experience life and society, and we make a contribution, and then we go to retirement and age. So we are in a war in the neurosciences to find out ways that we could optimize our continuous contribution to the world around us. And that to me is amazingly fascinating. When the brain is injured, that whole process of brain disorganization and destruction is accelerated. And our job in the neuroscience world is to mitigate the effects of such injuries. It starts with first preventing the injury from occurring, and then if it does occur, how do we reduce what we call, we say time is brain, how we try to preserve brain cells. There's a concept in our field called neuroprotection, and that is our main focus, is to protect the brain. So in the early stages of injuries, our main goal is to prevent these cells from dying or not functioning appropriately. So we utilize measures in the ICU to preserve the body and the brain. And once we preserve as much as we can, we try to give the brain a chance to be reorganized, to perform the functions that it has learned over many years of development. And the last phase would be, if we can't reorganize the brain to that degree, then we look at what we call compensation. How do we compensate the human, or how we compensate the environment in which the human exists so that we could optimize their function? And what we don't like after injury is that when the brain doesn't function according to what we expect in society. And we see a lot of discrimination, we see a lot of insensitivity towards people with injuries because they don't fit, they're different. They're acting ways that sometimes are not socially appropriate. We see high numbers of persons having trouble with the law, being arrested, in prison. And in my book, that's one of the things I addressed, is the amount of individuals who are incarcerated as a result of brain injury. Somewhere between 65 and 92% of persons in the prison system or incarcerated have suffered a concussion or traumatic brain injury enough to have lost consciousness. So clearly we know that this disorder affects our society and it affects how we function. In our field, what does neurological rehabilitation and neurotrauma entail? First, an understanding of brain injury itself and how it affects the individual and society. Second, it would be utilizing some of the traditional approaches that we've learned over the years in evaluating and treating patients, and now literally looking at custom approaches, developing some of those newer approaches. And one of the things I've been involved in is actually studying and looking at these new models of evaluating and treating brain injury. In fact, the next book I'm coming out with would be on treatment. But in this current book, I focus on a concept which I'll talk about in a minute called the Beth method. The other part is to educate and train patients, family, and clinicians about brain injury and its impact. So what do we commonly see in this specialty? Outside of the traumatic brain injured patients, where we see conditions like chronic traumatic encephalopathy, which is a form of dementia that occurs with repeated hits to the head. We see other forms of dementias like Alzheimer's disease. There are a myriad of other dementing illnesses classified in certain ways based on your gene, how they're derived. And there are some causes that we have control of in terms of our own health status. So we have vascular dementia, people with hypertension that don't take the blood pressure medications, or diabetes that's out of control. They tend to have damage to brain structures and could become demented. Certainly having cerebrovascular disease, strokes, where you have limited blood supply or hemorrhages in the brain. That's another, we deal with these disorders. Disorders of the spinal cord injury, disorders of the nerves, the peripheral nerves. The peripheral nerves, when they're damaged, they are the messaging system that sends information to the brain. They're sort of the input part of the leg in brain functioning. There are some autoimmune diseases where we produce antibodies against ourselves. The SARS virus that causes COVID, its typical way of causing injury is by creating an immune reaction where the body reacts to the virus, but the body destroys its own self at the same time. And so we're dealing with, this would be classified as a post-infectious or infectious condition, or the number of infections that could lead to brain dysfunction. The other one I didn't speak about here in the slide was brain tumors and neoplasms of the nervous systems, either formed primarily in the nervous systems or metastasis from other organ systems. At our center, we utilize what we call the interdisciplinary approach, where it's not just about the doctor, but we have therapists, we have neuropsychologists, we have various disciplines that come together to be able to both evaluate and treat a patient. Certainly, as a physicians, we tend to become the captain of the ship because we are directing the care and scheduling it based on the timing. One of the issues in medicine that is often not paid attention to is what we call the natural history of a disease. And in brain injury, this is the challenge. At every stage that a patient goes through in terms of the recovery and restoration process, we will see different aspects of the evolution of the condition and require certain levels of therapy or therapeutic modalities. One of the reasons we came up with this concept called the Beth method, which I wrote about in the book, is because when we looked at the industry, we saw a lack of others understanding the natural history of the disease, how brain organization is disrupted during injury, and how it's restored. So the idea was to come up with a concept that's different from what's used in psychiatry. Psychiatry tend to use a kind of cookbook model. They use a classification system called the DSM. And it's a diagnostic statistical manual where they say that if a certain disease has certain elements, then you could call that disease, you could name it once they meet the criteria. Well, in brain injury, where you have structural and physiological injury to the brain, doesn't always work that way. Because what you have is you have destroyed the organization of this complex nervous system, and it's affected in a multidimensional way by issues like severity of the injury. So the more severe the injury is, the more disorganized the brain and the more disrupted the function. The stage at which you recover, whether it's right in the ICU or a year or two following the injury. And so the whole idea is that in the entire field of brain injury, particularly in concussion, only in the recent years, concussions were recognized as a signature disorder that affected people, particularly in the military and also in sports, to the degree that we've come to. And now we have a better understanding what I've been able to perpetuate in our field is this whole idea of knowing where you are in time and space and appropriately designing a treatment program or modality to fit what the patient would need. What's happened in our industry, because we have not paid a lot of attention to this natural history, we are now utilizing therapeutic modalities at the inappropriate time. So we've not been able to clinical studies to be able to adequately come up with methodologies that are effective across the board. And some methods might be effective, but we may be utilizing them at the wrong time, given the complexity of the brain. So the Beth method goes by brain hierarchical evaluation and treatment methodology. And that uses this idea of brain disorganization, brain organization, following injury to come up with how to approach the diagnosis and treatment of the brain. Okay, good. So this is a picture of my book. And I think that's how you guys got to contact me, through the social media material that we've been putting out. And Ellie, I give her a lot of credit. She says about you guys, she just graduated from college with a degree in psychology, and she's amazing. She's done a tremendous job in preparing many of the material. I'm basically new to the social media platforms out there, but she's amazing in the way she's been able to attract attention to our page and to our both the Facebook and Instagram, and to get the publicity out on this book. Now, this book was written with lots of stories about my patient and my experience. And in fact, I'll just show you a copy. I think you have one there, but this is it. I think you have a copy there to look at. And the whole idea was to promote the Beth method and to also raise the awareness in the brain injury community and the world that brain injury is a silent epidemic. When you think of the number of persons annually that are affected by this condition, just in the United States, you're talking more than 3 million people are impacted by this condition on an annual basis, and worldwide it's even more. It's amazing that we have not paid more attention to this disorder and how much it affects functioning. And you know what I've found over the years is that many children suffer concussions or brain injury at an early age, and we as a society fail to realize how much these injuries actually impact people in their later years. Or, you know, a lot of kids, you guys have attention deficit, or they may be diagnosed as having autism or bipolar disorder, or trouble focusing, restlessness, trouble with antisocial behavior. Even many persons get on substances that are not healthy for them. But those situations occur in many cases because the brain was injured at an early age. And certain conditions like panic disorder, anxiety, phobias, dizziness, vertigo, trouble going on rides, headaches, many of those might have occurred from a trivial injury that they may have suffered as a child or been in a road traffic accident and not realize how much it impacts on their lives. And in fact, part of my reason for writing the book was to raise the issue that in fact, this is a silent epidemic and it impacts the society in more ways than we could realize. I told a story about a young man in the book in the very first chapter, family from Venezuela. I was quite amazed. He was studying dentistry, and he was involved in a wakeboard incident where at a high speed, he was thrown off the wakeboard, hit his head. He was known to have a concussion, got medical attention, but went back to the same sport prior to being completely recovered from this injury. What actually happened, he had a similar incident, and this time fell into the water. Imagine when the boat is going at a high speed, impact in the water is like hitting your head against a brick wall. So these high-speed injuries cause significant injury, mainly to the deep structures, but sometimes the surface structures of the brain. So he had a condition called diffuse axonal injury, where there was sharing of those wire system and the connection systems in the brain. In addition, he had a hemorrhage on the surface. After being in a coma for almost a year, he woke up, but with severe disability. He's able to, in fact, I saw him yesterday. He was able to do math, he could communicate, but his processing speed is quite slow, not able to walk, and so forth. So he was an amazing patient I took care of. We had to use some really extraordinary methods with medications and therapeutic modalities to get him to the state that he's in. And I'm quite impressed with his family. What is even more amazing, his younger sister spent, when she was in high school at the time, and she started volunteering at my clinic and decided that she wanted to go into medicine. She's graduating from medical school this year and is going to be specializing in neurology. She's just completing the interview process. So I was just, so out of a situation that has a not so good outcome, something positive could come out of this. So that is the story of all of our lives. So in this case, as you know, the way the brain works, you have coverings on the brain, on the surface of the brain, and between the coverings on the surface of the brain and the skull, there is also a space called the epidural space. And usually when there's a fracture or there are some arteries in the space between the skull and what we call the meninges, and those rupture, they cause something called an epidural hematoma. Underneath the covering of the brain, you have what's called a subdural hematoma, where it's closer to the surface of the brain. those bleeds are generally venous bleeds, and they're not as under much pressure as the arterial bleeds, because as you know, the blood from the heart is at the higher pressure than the blood returning to the heart. It's at a lower pressure. So the epidural hematomas tend to be more ominous in their presentation, and they need more rapid decompression and surgical management because they cause significant shift in the brain from one side to the other, causing further damage. One of the things that you should note that after an injury to the brain, that injury continues. And part of our job is to prevent further injuries from going on. Like I said in the early part, we want to preserve the brain, what we call neuroprotection. So I'll conclude by saying brain injury as a construct, it's a fascinating area of neuroscience to become involved with. I'd encourage all of you to take a look at it. Neuroscience as a whole is an underrepresented specialty when you look at the amount of persons that suffer neurological disease in the future, with the rates of communicable and non-communicable diseases that we've seen in our society, the chronic illnesses, many of these individuals suffer injury to the nervous system. So there is, in the next 20 years, there will be an intense need for persons in the neuroscience area to be able to solve fundamental problems of humanity. And I encourage you to look at that field. It's exciting, it's challenging. I'll also say this, my mom, when I was growing up, always said to me, you should look at a field when you're choosing a career where not a lot of people are interested in. There's a high demand for the services and often very challenging. When things are challenging, most people don't want to do it. So, and somebody like myself, given my origin, my upbringing, where I found myself, had a tremendous opportunity because I made those decisions to go into such a progressive field and study. I'm grateful for the fact that, you know, I've been able to function at the top of my game. So I encourage you to look at the field. I think it's for persons at your stage, it's brain science. There's so much new things that are coming out on all levels that is fascinating, that would bring new cures and new evaluation tools and modality. I encourage you to take a look. So I'll stop right now and I'll wait for any questions that you might have.
Thank you so much for that presentation. I think everyone in the chat, we were just really fascinated with how much of the statistics we didn't know and how much more prevalent it is than we really think about. So thank you so much for bringing awareness to that. There were a ton of questions, so we'll go ahead and start with some. I think one of the most common ones was people wanted to know, and this is kind of a broad question, but what your day-to-day life is like. So do you do clinicals, certain days? If you could kind of go through that, a weekly schedule.
Well, you know, as I get older, I'm becoming slightly more organized, because then you're not as efficient as you used to be when you were younger. And that sort of evolves every year. I'm in a very dynamic environment where at 1 minute I'm making a decision about finance and employment of people and structure and process and in the business side of things. And then the next minute I'm making a decision about somebody's life in terms of what do I do with the CAT scan that I found a mass in the brain, or sitting with a family member and talking to them about the consequences of something they may or may not do in their lives, or the potential outcome of a disease condition that's devastating. And another time I'm teaching residents, medical students, students like yourselves, and imparting the knowledge and experience that I've acquired over the years. So it's a highly dynamic life. Now, some people look at me and say, you have no life because you're so busy at all times. And I'm writing books now and giving talks and so forth, which I've done all my life. But for me, it's really exciting to be able to be relevant and to engage and be a part of a moving world. I think that's part of why we exist. It's fascinating that, and I've always been an agent of change. Most people see change as a risk factor in their lives, but I see change as opportunity. And so you can't always predict where you're going to be and what you're going to do in your life, but certainly you plan the best you can. But I've viewed this type of approach as trying to, in whatever state or whatever place I find myself, to, to live to the max. And so in organizing my life around my daily activities, irrespective of the fact that I'm doing many things, I find it very uplifting. Now, not everyone in their lives are cut to do that. I must say that some people need more structure, more organization, so they don't have so many things to do. But the whole idea is a good part of my life involves delegation and giving others an opportunity to do what they do best and stay back and do what I do best. And part of the learning experience is learning how to delegate and how to not just be the center of attraction at all times. It's important to give others a chance.
Great, thank you so much for that insight. Another really popular question that we had was, do you feel like your DO background has helped you in neurology? And if you could kind of talk about like DO versus MD in neurology and what trends you see.
Fascinating question. When I graduated from medical school, and actually when I started medical school, there was this notion that being a DO meant that you had less education and you were not as qualified. And that type of philosophy, I'll say, maybe got thought over the last 10 to 15 years, because DOs are in every facet of the medical profession. In the military, in the government, in academic centers. When I got to the University of Miami, I was perhaps maybe the second or third DO that got accepted into a major medical institution to do a residency back in those days. And the expectation was that I had less preparation. The concepts of medical school and who would make a good doctor has changed over the years. The DO profession offers a very holistic approach to medical science, and we've seen the allopathic or MD profession move in that direction. We still have a mentality of specialities, or subspecialization, because I'm myself a super specialist. But I've in my early education, I've learned this very holistic way of looking at the patient as an integrated system. And that has helped me tremendously, particularly in neuroscience. DOs tend to favor the profession, neuroscience as a profession, over many other fields because of this need for integration. So we're heavily in neurology, in physical medicine and rehab, and those fields where there, team approach is necessary. In primary healthcare also, those are areas, pediatrics, you tend to see more DOs. But again, that's changing. This year was the first year that the AOA, the American Osteopathic Association, and the ACGME training have merged together. And I think the merger has occurred on the residency level in order to take the strengths of the DO and the strengths of the MD and bring that together in education. I think that's very powerful. So one of the things I'll also add to is the musculoskeletal approach to things. The skeletal system is part of what keeps you erect and keep you going. DO spend a lot of time looking at the biomechanics of the musculoskeletal system and how that impacts, how it's impacted in disease and how it impacts other diseases. And so I've been able to use that in my rehabilitation training and participation to explain the biomechanics of how the body changes when it's disruptive. Why do you get back pain when you have a leg-length discrepancy? Why do you get headaches when you have a cranial nerve abnormalities and you have double vision? Why do you have, when you have dizziness, you have neck pain and back pain, and your gait and your balance changes. And just tying all of those to the nervous system has given me a tremendous perspective on the mind-body relationships and the integration of body systems. So this is where I believe the DO profession has helped me in conceptualizing medicine as a whole.
Thank you so much. I think that answers a lot of everyone's questions, and a lot of people said thank you for giving that information because it was definitely very useful. We did have a couple questions, a little bit more specific, more of a case idea. If someone has a history of minor concussions from sports injuries, such as high school sports, could that affect their chances of getting a concussion as an adult from injury?
Again, a very interesting question. What we do know that people who have suffered a brain injury, in about 20% of the time, when a person comes in to the emergency room and we see them, one of the things we find out is that 20% of them would have had a prior injury. So there is an increased vulnerability to additional injuries, both in sports and in other areas. And it could be sometimes, one, people engage in more risk behaviors after a concussion that would lead to another concussion. They lose their edge. So in terms of motor versatility, skill, making sound and quick judgments, oftentimes that in itself could place a person in a more vulnerable situation. And also some of the psychosocial issues and the interpersonal conflicts that we see, the risks in driving and operating an automobile. All of those contribute in some way to a higher incidence of repeated concussions.
Thank you so much. We had another question that was, or a lot of questions actually, that were asking about what has been one of your most challenging cases in your career?
Well, I've had many. So challenge come when you have a difficult patient to diagnose and also difficult to treat. But challenge also comes when there is a ton of emotional drain on you as a human being. And especially when it comes close to home, either somebody that's related to you or a close friend, or looking at a person who at a young age, before they've had a chance to make a contribution, where their body's ravaged by a neurological disease. If I were to say that case I referred to in the one I presented was one of my most challenging cases because he had all three elements. At one point, we had to make a decision whether or not we would let him die. And it was funny, I was out on a trip and the mom, all of the other doctors said, time to let him go. And of course, his mom said, no, wait until Dr. Nedd arrives and then we'll make the decision. And what was fascinating is that the patient had a mass in his brain after multiple surgery. And it was an abscess with pus. And he was in such dire medical shape that all of the doctors thought, no, it would not make sense letting him continue in that state after all those surgeries and severely injured. And so they made the decision not to do anything. And I was out of the country, and of course the mom called me and said, you know, and I was trying to convince her maybe that's the right thing to do. But by the time I landed, it was kind of fascinating. I went to the room and I looked at the patient and he was almost wide awake. But what happened was that pus pocket in his brain had so much pressure that it ruptured the skin in the scalp. He didn't have any bone in that area at the time, and all of the pus just naturally drained out. So rather than the neurosurgeon going in and actually doing a surgical procedure to remove the pus, the pressure was large enough that and of course, by just decompressing the brain on its own, the patient started waking up. So it was kind of amazing how nature does its own surgery at times. And that case always, that's one of the reasons I wrote about it, because it had so many corollaries in looking at what happened. And then, okay, after this, of course, there's this whole emotional tug of war. And even with your colleagues, you have to literally fight with them because, you know, in medicine, we all share different opinions about particularly end-of-life issues. And then, of course, living with a disability, how much does the family want to, you know, one family would say, I'd rather not have a disabled person to that extent. I'd rather them, or the person might say to themselves, I don't want to live like this. And then after this was the management of the patient with all of the medications and the treatment modalities, you know, having seizures and increased pressures in the brain and multiple surgeries, and understanding every stage. You use a drug now and it'll work, but 6 months later, the drug will have the opposite effect. So having a clear understanding of the brain at each stage was very, very difficult. And this is not the case where you could go into a textbook and just come up with a cookbook answer. You have to use science and use your own experience and understanding of what the brain is doing. So this, I would say, would be one of the most difficult cases. I named you know, he goes by Mario in my book, but clearly he had all the elements of diagnostic challenges, treatment option challenges, and also the human side of dealing with the patient.
Thank you so much for sharing that story. Everyone in the chat was really amazed. That's awesome. There was a really good question earlier asking if you mainly see, or I guess just neurologists in general, do you guys see people who are coming to you because they've had TBI, concussion, or do people also seek out neurologists for preventative help?
I'll say most people that come to us have something catastrophic going on. And there is sort of what we call some functional neurologists that are emerging, where they're looking more at the holistic aspects of prevention. And I have to say, being a DO, that was one of the areas I was trained heavily in. So in my practice, I spend a lot of time counseling patients about their disease and their condition, because many times just understanding the nature of what you're going through and the consequences of every action, just by not saying, look, take this pill or go to this treatment, it is this whole area of prevention and education, patient education, is critical. People, when they participate in and understand what's going on, tend to first accept the disease condition and are better able to live with the consequences. And they're also better able to help themselves. So this is a very important part of the neurosciences, and it's really underrepresented. And again, we are focused so much on the disease, we spend little time on the prevention. Now, particularly in my field, we spend a lot of time looking at getting people to wear their seat belts and helmets and biking safely and crossing the streets, and especially with kids, to prevent these types of injuries. Safety in products that we have on the market, the cars, the airbag, the seat belts, those kinds of things. And even in sports, trying to make sports more safe. Those are all important parts of what we are involved in. And again, not all neurologists do that, but certainly because of my training, my background, and being in the field of injury, this is a major part of what we do on a day-to-day basis with our patients and also to the public.
Great, thank you so much for that explanation. There was several people wondering about, for college students who are already interested in neurology, what kind of research projects would you recommend that they start getting involved in or looking for?
Well, first, I'll tell you about some of the challenges about doing a research program in neuroscience. Most research projects take years because of the many moving parts when you're doing neuroscience. So given, you have to spend time studying, and you have to spend time with the books, and time, looking for residents, for applying to school and so forth. So you have to choose a project that you could basically complete. And usually it's a sort of piggyback on something else that someone is doing. And again, most projects now in research require you to have qualifications, because we're dealing with what we call human subjects. So they're governed by laws that if you're not qualified and you don't have a license, you can't do certain things. So an area, like I said, the best area is to focus on working with an existing scientist or neurologist and participate in something that's ongoing. Always good to get your name on a paper or publication that's coming out. Many students spend their time doing case reports or helping to analyze data, and those are good areas. Now, opportunities, particularly in neuroscience, very focused on things like epidemiology, the occurrence of a disease, how frequent you see these, what are the consequences, what are the signs and symptoms, what's most common, what's less common. Those are more, these are on the epidemiological side, and people tend to focus more on those. The bench science, like the rats and the labs and the primates, studies are a little bit more complex, and they require more technical skills that you have to learn in order to get things done. When I was in college, I did some stuff with animal behavior, studying how seagulls and crickets communicate. And I was part of a big lab and would follow along with the professor and learn some of the acoustical instruments. So you had menial jobs, but you got to see the most advanced aspects of it. So it's very nice that, that's on the behavioral side. But the bench research, the stuff where you have to go into a lab and deal with chemicals and so forth and tissue, is a little bit more challenging as a student. Literature review is also a good area to start by taking a topic, studying it, collecting the data, reviewing it. It also gives you a chance to advance your knowledge and to learn about certain methodologies. So, but what I would say is, call your university next to you, find out what professors are doing, which research, and ask them to shadow you. A lot of doctors would cherish that. There are certain limitations about getting into labs. Some of them have government level security that you have to get through. Those might not be available to you, but even going into a routine lab, like in a pathology lab or a chemistry lab, and spending time with the technologists and learning about what they do, those are all important part of the science of research.
Thank you for that. That's great. There's so many people talking about how much they love research and excited about it and how they want to go into it a little bit more. So that's awesome to hear. We had a really interesting question that was, after brain injury, is there a possibility of regeneration of brain function, or is it more about adapting to life post-injury?
I just did a blog on that, on an area called neuroplasticity. It's a vlog, actually. And if you want to learn a little bit about it, you could listen to it on our website. This whole idea of how the brain restores itself and how it adapts is fascinating. Now, the brain has, prior to birth or during the developmental period, the brain is in a natural way able to restore itself more so than the adult brain. So the younger you are, the more, the better your chance of regeneration. But the ability for the brain to develop new cell lines is limited. But the brain does significant adaptation. Now, the hippocampus, where a lot of your memory systems are located, is perhaps the area of the brain where you have more neuroplasticity taking place. Also, by coincidence, the olfactory system has tremendous amount of neuroplasticity. Those are two areas in the brain that you see. The challenge is once, and there are factors, what we call nerve growth factors. One of them, BDNF, these are neurotropic factors that encourage cells to either regrow or restore in terms of repair. And so, yes, there is some degree of neuroplasticity taking place, but what the brain does best is compensate, shifting functions from one place to the other. There's a lot of redundancy already built into the nervous system. So if you lose function in one place, it has the ability to shift that function. Maybe not as efficient as before. Now, what we do know about restoration is when the brain has more time to restore, you tend to see less deficits. So like when someone loses brain cells over a long period of time, it takes, you see less challenges in terms of their neurological functioning. So for example, if you get hit in the head once, very quickly, and you have a hemorrhage, you have a sudden change in brain function, you tend to lose more brain function. As compared to, say, if you have a slow-growing tumor that in 10 years grows to the size of the hemorrhage, your brain has more time to shift and adapt its function. So brain restoration and brain adaptation has a lot to do with the speed at which injury occurs and the opportunity for recovery. So we tend to see more compensation than we do see this whole idea of the brain recreating itself in that sense.
Thank you for that. It's very fascinating. I highly recommend anyone that has a chance to take any brain development class to take it, because I've learned all this and it's very exciting and interesting to learn about. I guess we'll end with one last question and wrap it up. But as you know, hopefully we'll be getting a vaccine soon, but as we're still going through the pandemic, do you have any advice for the pre-meds out there and their future endeavors and how to just navigate this difficult time?
Well, let's say this. We've never lived in a time like this that we are aware of in our lifetime, and certainly in generation past, they've seen prior pandemic. But when you look at the complexity of this condition and how much it's affected society, economics, social order, relationships to each other, ability to travel, our emotional health, our medical delivery system, how we finance things. We have to rethink the world. I mean, look, when you think in my lifetime, how many generations of changes that we've seen. I mean, just think the advent of the computer system, Microsoft, the internet, now social media, everything is accelerated, just the drug development that we have. So we are fortunate that in these times that we are able, irrespective of the response that we've had to this disorder from our politicians and our scientific community, irrespective of that response, you have to think that the world is way better off than it was in the turn of the century or in the 1800s when they had the Spanish flu to respond. So yet, despite the amount of lives that we've lost and continue to lose, and despite the nature of humans, so that we can't restrain and hold ourselves back, and despite the fact that we are narcissistic and don't think about our neighbors at times, we are able to get through this. And I think part of the lesson for your generation is, I think it's a wake-up call. Our generation, that wake-up call is now. It's kind of come home to roost. But because when you think of all the issues that we didn't address in our times, and the ones that we did address, there is good and bad in this lessons that we could learn from this experience. But I'll say for your generation, more so, is you guys, and I applaud what you're doing because it shows that you're able to take responsibility, see a problem, organize a group of people, and come to it with a level of solution that we don't. And the one positive thing I could say more than anything else, and I applaud you guys for that, is your ability to organize. You know, we operate in a world of silos where we don't talk to each other. And some of it is tied to our own ego and our own desire to survive and to be better than someone else in this regard. But the fact that you guys are putting your state, you know, dealing with the vulnerabilities of risk in looking at your own lives and how others, you know, people from different socioeconomic background, racial background, experiences, and looking at the world in not such dichotomous ways. But you don't have to be a 4.0 to be a good doctor. You don't have to go to Yale, Princeton, or Harvard to be a good doctor. You know, what we're doing is taking our humanity and leveling it. And it's funny, and that goes for, you know, I have a friend that's religious in the sense that from one of the Eastern religions, and one of the things he was telling me about is that the whole idea of equality in how we look at the world is one way of creating balance. And I think your generation, and when you look at what's happening in the world, both politics and science and so forth, I really think you guys have a tremendous opportunity to help the world strike balance, because I think that's what's going to preserve us as humans for the long-term future.
Thank you so much for all of your advice. We appreciate your time this morning. This was awesome. We all learned so much.
Well, great, and thanks for the opportunity.
Yes, of course. If you open up the chat, you can see all